Vaginal prolapse causes and symptoms. A vaginal prolapse or pelvic organ prolapse occurs when muscles of the pelvic floor no longer support one or more organs located in the pelvis. According to the Office of Women's Health or OWH, vaginal prolapse occurs when muscles in the pelvis become loose. This causes one or more of the pelvic organs to protrude into or out of the vagina. Sometimes a person may not notice any symptoms. Others might feel discomfort or pressure in the pelvic area. Treatment is available, and a person should discuss their symptoms and treatment options with a doctor to determine the best course of action. How does it happen? The female pelvis contains several organs, including the rectum, uterus, vagina, urethra, bladder. The pelvic floor, which is a structure made up of muscles and connective tissue, supports these organs. Pregnancy, childbirth, injury, surgery, or other causes can weaken or stretch the muscles and connective tissue of the pelvic floor. If the muscles can no longer support the weight of an organ, the muscle and connective tissues may collapse and cause the organ bulge into the vagina. Types of vaginal prolapse. There are several different types of vaginal or pelvic prolapse. Doctors identify them according to which organ has collapsed and where. According to the American College of Obstetricians and Gynecologists, or ACOG, the different types of vaginal prolapse include vaginal vault prolapse. The top of the vagina loses its support and drops into the lower part of the vagina. Rectocele. The rectum bulges into the vagina. Enterocele. The small intestine bulges into the vagina. Uterine prolapse. The uterus collapses into the vagina. Cystocele. The bladder drops into the vagina. What are the symptoms? A person may not notice the signs and symptoms of pelvic prolapse when it first occurs. The individual experiencing a pelvic organ prolapse may notice discomfort and pressure during sexual activity. Some people report a worsening of symptoms at different times of the day or after standing for a long time. Other symptoms include painful vaginal intercourse, a bulge in the vagina, feeling pelvic pressure or fullness, urinary incontinence or leakage, organs bulging out of the vagina, difficult bowel movements, trouble completely emptying the bladder, vaginal dryness, problems with inserting applicators or tampons, lower back pain, tissue protruding from the vagina, difficulty inserting tampons. A person who experiences these symptoms, or if these symptoms get worse, should schedule an appointment with a doctor for an examination. What can cause pelvic organ prolapse? Weakened pelvic muscles and connective tissues are the leading cause of pelvic or vaginal prolapse. There are several potential reasons why a person's pelvic floor may weaken and cause pelvic prolapse. Having overweight, pregnancy and childbirth, work that requires a lot of heavy lifting, hysterectomy, long-term constipation, aging, menopause. In addition, a few different conditions may cause the pelvic floor to weaken. This can include Marfan's syndrome. A symptom of Marfan's syndrome is a hernia in the groin or abdomen. According to an article in the International Neurology Journal, people with Marfan's syndrome commonly experience pelvic organ prolapse. Ehlers-Danlos syndrome. This is a condition that affects the joints, blood vessels and skin. It can affect collagen, which is a key component in connective tissue. According to the International Urogynecology Journal, females with the condition are at a high risk of developing pelvic organ prolapse. Joint hypermobility syndrome. Pelvic organ prolapse is more severe with those who have joint hypermobility syndrome. Diagnosis. A doctor may notice a prolapsed vagina during a routine visit. They can often make a diagnosis through an examination of the area and having the person follow instructions for tightening or relaxing their muscles. A doctor will ask about a person's symptoms. If the person is having trouble urinating, the doctor may order tests to examine the urine for signs of infection or other issues. Risk factors. Certain risk factors can make a vaginal prolapse more likely. Some potential risk factors include smoking, lung diseases that cause a lot of coughing, having overweight or obesity, lifting heavy objects as part of an occupation, chronic constipation, family history of prolapse, vaginal childbirth, especially involving multiples or prolonged labor. How to help prevent pelvic organ prolapse? It may not be possible to prevent a vaginal prolapse. However, a person can take the following steps to reduce the risk. Maintain a healthy weight. Avoid lifting heavy objects. Treat or take steps to prevent constipation. Avoid smoking. Perform Kegel exercises to help strengthen the pelvic floor muscles.